Hello everyone, welcome to Capsa. I am Sri and today we are diving into Meniere's disease. This condition affects the inner ear and can lead to a range of symptoms including dizziness and hearing loss. Let's explore what Meniere's disease is and its causes, symptoms and management strategies. So, Meniere's disease is a chronic inner ear infection that affects balance and hearing. It's named after the French physician Prosper Meniere, who first described it in 19th century. The inner ear has two functions, hearing and balance. Meniere's disease disrupts these functions and leading to a variety of symptoms. Now, according to American Academy of Ophthalmology and Otolaryngology Committee on Equilibrium described Meniere's disease as a disease of membranous inner ear characterized by deafness, vertigo, and usually tinnitus, which has its pathology correlate hydropic distension of endolymphatic system in 1972. Now, here is a quick look at the inner ear. It consists of cochlea, which is responsible for hearing, and the vestibular system, which helps with balance. Meniere's disease primarily impacts with vestibular system and cochlea. So, two subtypes are vestibular Meniere's disease and cochlear Meniere's disease. Okay. Now, what are the risk factors? First one is middle ear infection. It means, is there any kind of infection associated with herpes virus? Okay. Second one is stress. Third one is head injury. If there is any kind of respiratory infection, smoking, alcohol is use, this kind of risk factors are involved. Okay. Now, what are the causes of Meniere's disease? The exact cause of Meniere's disease is unknown, but it is believed to result from a buildup of fluid in the inner ear, known as endolymph. This fluid buildup can lead to increased pressure and disrupt the normal function of the inner ear. Factors that might contribute to this fluid buildup include genetic predisposition, viral infection, autoimmune responses, this kind of things. Now we will look into the pathophysiology. So there are so many theories behind endolymphatic hydroformation, including obstruction of the endolymphatic duct or sac, hypoplasia of endolymphatic duct or sac, alteration of the absorption and production of the endolymph. Is there any? If there is any autoimmune infection, viral etiology, this kind of theories are involved in pathophysiology. So, due to etiological factors, it leads to increase in volume and overproduction and decreased absorption of endolymph, which will obviously increase the pressure in the inner ear or the membranous labyrinth, which leads to misfiring of the vestibular nerve. As a result, distension will occur. Okay, which leads to rupture and mixing of endolymph and perilymph fluid is found. Mixing of two fluids, endolymph and perilymph. Okay, which leads to, because of these two fluid mixing and these two fluid have different composition, Electrolyte balance will disrupt within the labyrinth, so it leads to electrolyte disbalance. As a result, symptoms will appear, which leads to disease progression. Disease progression, sorry. Okay, so what I have said, due to some etiological factors, it will leads to increase production or overproduction and decrease absorption of the endolymph, which will increase the volume. As a result, the pressure will increase in the membranous labyrinth, which leads to misfiring of the vestibular nerve. As a result, detention will occur. And this leads to rupture and mixing of two fluids, endolymph and perilymph. Because these two fluids have two different compositions, electrolyte disbalance will occur within the labyrinth, which creates the symptoms or appears, symptoms will appear and the disease will progress. Okay. Now, what are the symptoms? So, symptoms of Meniere's disease can vary but typically include classic triad of symptoms like episodic true vertigo. What is vertigo? A spinning sensation that can be intense and lasts from minute to hours. Second one is sensory neural hearing loss. This often fluctuates but can become permanent over time. Third one is tinnitus or ringing or buzzing in the ear. And others are oral fullness, vomiting, nausea, false discomfort. Oral fullness actually refers to a feeling of pressure or fullness in the affected ear. Okay. Now, what are the diagnosis procedure? First one is history collection. Second one is physical examination. Third one is various tests like Rhomberg test. And this Rhomberg test actually assesses a person's balance and neurological functions. Weber tuning fork test. This test and Rinne's test used to diagnose hearing loss. Others are audiometry, transtympanic electrocochleography, electronystagmography or ENG. Electrocochleography actually used to detect the distortion of neural membrane of the inner ear. Others are lab studies. If there is any infection occurs, so for this purpose CSF examination, urine analysis should be done. And last one is imaging test like CT scan, MRI, this kind of things. Okay. Now, how will you manage Meniere's disease? So, managing Meniere's disease involves a combination of lifestyle changes, medication, and sometimes common strategies. First one is dietary changes. Reducing salt intake can help manage fluid levels in the inner ear. Second one is medications. Diuretics like hydrochlorothiazide may be prescribed to reduce the fluid retention. Anti-nausea medications like promethazine and anti-vertigo medications like meclizine diazepam can also help alleviate the symptoms. Third one is lifestyle modification. Avoiding caffeine and alcohol reduces the symptoms. Stress management techniques can also be beneficial. Fourth one is therapies. Vestibular rehabilitation therapy can help with the balance issues. Fifth one is surgery. In severe cases, surgical options might consider to reduce the fluid buildup or to cut the nerve that controls the balance. So it is important to consult with healthcare provider for a proper diagnosis and treatment plan tailored to your specific needs. If you have any queries your question and need further information, feel free to leave a comment below. Thank you for joining me on this journey to understand MD or Meniere's disease. Don't forget to like, subscribe, and hit the bell icon to stay updated with latest content. See you next time on the Capsa. Thank you.